Why is your dental implant failing? Today we're going to talk about the 7 top reasons as to why an implant failure can happen.
Let's dive in. So the first thing you may notice about your dental implant or why it's failing is because you may feel it getting loose.
You can have increased sensitivity. You can start to notice that when you're biting down, you're going to start having some soreness where that implant is. So there's a lot of different things that can go into that.
All right, so what could cause an implant to be loose early on during the time that implant was placed? So you just went to the dentist, you had an implant placed like 2 weeks ago, everything felt fine the first few days, but after a few weeks go by, you're noticing a little bit increased sensitivity, increased looseness of the area, especially when you touch the area, you notice pain. Typically after an implant is placed, after a few days, the area should start to subside and not have any symptoms. But some people do experience that they're starting to notice some pain associated with that, and that is a concern, and that's something you definitely want to let your dentist know.
With that being said, the first 3 to 4 months is the time of osseointegration. During that time, you're going to need to keep the implant very clean. The number one reason that an implant can fail is called perioimplantitis. This is usually caused by poor hygiene, smoking, or maybe some pre-existing gum disease. So a lot of the times, the reasons why you lost your teeth to begin with can also be an implication of something you may need to pay attention to in the future after you replace with the implants.
Right, so when you have this happen, you may notice the sensitivity, you may notice the looseness of the implant, you may notice a gap, especially if an implant was placed and you have a crown on it now, you may notice more spacing between the adjacent teeth where the crown was placed. So these are all signs of the periimplantitis. Poor health, poor hygiene, even your gum health. Sometimes, we're placing implants when there's not enough tissue, for example, or not enough bone, that can also cause periimplantitis.
Another reason that an implant can fail is due to poor osteointegration. So like I said, you have to give the implant 3 to 4 months to integrate with your bone, which means that it's going to fuse with your natural bone and become one. A lot of times, people are in a hurry. They want to get that implant restored, whether it's one tooth or even an all-on-4 procedure, and you really can't rush that process. You got to give your body time, and everybody's body is different due to health reasons, like we said. So if you don't give your body that full time to heal, there is a chance that you could have poor osseointegration, and then we're going to be looking at problems further in the future.
Exactly. One thing to remember is not everyone heals the same way. Typically, literature says, anywhere from 8 weeks to 12 weeks is the osseointegration period for most people. Some people will be sooner or some people will be later. So in our office, we try to make sure we wait enough time and we take x-rays before we start to restore the implants to make sure that osseointegration has happened, that the bone level looks good, the tissue looks good before we start proceeding with the prosthetic part of the implant. And that's something we definitely want to take into account before you move forward with placing the implant, because the implant and the bone is the foundation. Everything else on top is, if the foundation is not strong, then you're going to have problems long term.
Alrighty, so let's jump into number 3. Number 3 is basically called mechanical overload. As we've talked about in some of our previous videos, we've talked about as to some of the reasons why people lose their teeth. A lot of times, some of those reasons are just clenching and grinding. Over time, they rub their teeth down until there's just basically little nubs left, and we don't really have enough to work with and restore. They'll gain excess bone on their jaw. And with that being said, when we go into the engineering part of making the prosthetic that's going to go on these implants, there's so much that we have to look at. So if we put excessive force on these implants and the bite is not aligned just right, it can cause those implants to fail as well.
Hi, my name is Dr. K, and I've helped thousands of smiles change over time with dental implants.
I am Erica. I'm the lead surgical assistant here, and between the two of us, we've both been doing this for about 20 years. We have a lot of experience, and we are just trying to inform you on what are some of the reasons why implants can fail.
All right, let's keep going. So, patients who are smokers, for example, they're going to have more risk in implant being loose or failing earlier on. Just because it does interfere with the osseointegration we've been talking about. With the smoking, the nicotine is a vasoconstrictor, so it causes poor blood flow to the area for healing of the bone, the new bone that's being formed. So because of that, you will have some patients, not all, some patients may not get the strength of the bone that they need for that implant to really last a long term. So you get the implant placed, you wait the 3-4 months, and then you get the crown placed on that, and then you go on your way for about 6 months to a year, 2 years, but then you start to have problems. Part of that is because of the smoking. So smoking is definitely a contributor to why implants can fail early on.
That is part of the systemic health conditions as well. And just so you know, studies have shown, and they've done these studies over time, that smokers do have an increased chance of 10 to 20% of higher risk of implant failure. So just keep that in mind. If you are a smoker, that is something that you're definitely going to want to cut down on and possibly quit if you're going to make the investment into doing full mouth implants or even just individual, because it makes it very hard to warranty the work if you continue to smoke.
Exactly. Other, health conditions, for example, like people who are diabetic, especially if your blood sugar is not controlled, your A1C is high, you're not going to be a good healer. So that's another reason why your implant that was placed may fail early on, is because of that. I've had patients with A1Cs that were high. We placed implants, knowing the risks, and then later on, they had issues with it. So we take it out. We inform the patient that, they got to get their blood sugar, their A1C under control. And after some time, they do that, and then we place the implant again, and they have great success. So, we see that a lot. So don't let that be a deterrent of why not to get dental implants.
So to keep in mind, your A1C dentally, and especially here in this office, needs to be at least at a 7.5 or lower in order to have a good healing and good osseointegration. We don't want to have we don't want to be waiting longer than we need to put the prosthetic or the crown on top of that implant. So in order to get that good osseointegration, if you are a diabetic, please try to keep your numbers down, stay on your medications, do your walking, and make sure you have a good diet so that everything remains controlled and your success with your implant should last you the rest of your life.
Good job, Erica. Let's keep going on. So the next topic we're going to be talking about is medications. So some medications will cause some implants to possibly fail. Bisphosphonates is one, cancer medications, things like that. Patients who are having osteoporosis, taking some osteoporosis medications can interfere with the osseointegration. Do you know any others?
I believe people with autoimmune diseases, having to take certain meds. A lot of times also, being that you take a lot of meds, you end up with dry mouth and you don't produce a lot of saliva to get rid of the good and bad bacteria in your mouth. So that can also be a problem.
Yeah, it affects the healing. It also can cause more cavities around the adjacent teeth, can cause swelling, infection that can compromise implants that have been placed. So great job.
Okay.
The last one, which is also very important, or why implants can fail, was that they were not placed correctly in the first place. And we do see that sometimes, unfortunately.
So being a lot of people, and I think we also have another video about this that we have discussed about people going abroad or going to other countries to get implants done. They're not all FDA approved. There's just different techniques and the schooling is different. So sometimes, yes, you'll save money in the long run, but when you go get this treatment done, a lot of times when you come here and you're ready to restore, sometimes we are not able to help you because we don't either know the names of the implants or they were just placed improperly. So poor surgical technique is one of the reasons why there could be a chance of implant failure. But just do your research. You want to make sure, again, like I've said before, that your doctor is board certified and that they have placed multiple implants. Look at their reviews, look at their website, and see how long they've been in practice, because that will help you make a good decision as well.
Yeah, it's one of those things that you want to make sure that you go to a reputable dentist that's been doing this for a long time, that can stand by the work and warranty the work that you've had placed, because you want this to last a lifetime, hopefully. And if the implant is not placed well, even though that it may not fail, it may be very difficult to restore it properly, with the right size crown or whatever restoration we want to be putting over that implant. So, you got to definitely take that into account. And, I have seen great work come from abroad. So it's not just, going abroad, getting bad work. I've seen, mixed work even in the States, so it just comes with experience, making sure that you're placing a good implant and good bone on a healthy patient is the way to go with the right experience and right healing. So I hope this information was very informative for you, and if you did like this, please contact us. Please comment below. Our office is called Summit Point Dental Implant Center. We're located here in McKinney.
And don't miss out on our other videos. You can click over here to the right and there's going to be a whole list of them. So hopefully we can answer all of your questions for you.
All right. Thank you so much.
Thanks.